We still have a big issue with women and heart disease. Not an issue you might think, but an issue related to the detection, the appropriate diagnosis, and timely therapy. Why is that? Oftentimes, there are several reasons. One reason is, for example, that women oftentimes do present with what we call atypical symptoms. So in other words, a woman can have a heart attack, but not the typical angina, the chest pressure or the pain in the chest distributing to the left arm. The symptoms can be more what we call atypical. The other thing is, of course, oftentimes women might lack the classical risk factors, such as diabetes, family history, high cholesterol or high blood pressure, or smoking history. In any case, any kind of chest pain or chest discomfort needs to be taken seriously, whether it's in men or in women, and independent on the age. The reason why I'm saying this today is because we want to give you one example of one of our dear patients. Allison is here today to tell us her story. And her story is basically summarized as follows. She had more or less typical or atypical chest symptoms, chest pain. But for a long period of time, nobody in the medical field took her serious. She was not diagnosed appropriately. She was not recognized as being someone at risk for heart disease, and that can happen, of course. I'm not blaming any healthcare provider. But you have to think about the possibility of an underlying health condition. And Allison actually suffered from a heart attack at the age of 32. Not the typical scenario and not something expected, but it can happen. And years later, she had to have a heart transplant, and she is here now many years after heart transplantation and doing very well, and we see her frequently. But I want you to listen to her story, because even though it's not a typical case scenario, it makes us think and makes us evaluate more carefully, to be more critical, and especially in women, think about the possibility of underlying heart disease, even with atypical symptoms and lack of risk factors. Again, if you do have chest pain, if you have palpitations, have it checked out. Make sure there's nothing serious behind this.
Hi, I'm Allison. I had a heart transplant, and it all started at 32. At 32, I was having chest pain and all the different symptoms that men and women have when they're having a heart attack. I first called the paramedics, and they thought that I was a little crazy and couldn't see anything. And then I went to my primary care doctor, and he kept telling me I had an ulcer, which I knew I didn't have. I was having chest pain, pain down my arm, in my back, my face, my lips, and it was pretty constant on that day. The doctor told me that there was nothing wrong with me. I had an ulcer, so I went home, and then Tuesday it happened again. And then on Wednesday, it kind of came and went, all the symptoms. And Wednesday night, I was having severe chest pain that would not stop. And so we decided to go to the emergency room, and that is where they finally discovered that I was in fact having a heart attack. So after they discovered that I had a heart attack, a lot of tests were done, and they determined that it was caused by blood clots in my coronary arteries. And so they ended up doing angioplasty and placing a couple of stents, and I was in the hospital for about 2 weeks. After that, everything seemed fine. I did cardiac rehab, did all the things I was supposed to do to get healthy, and I was told not to get pregnant, but things happen, and at 35 I had another child, all while my ejection fraction was at 25, half of what it should be at 50 or 55. And I endured that healthfully and had a healthy baby, which I was really glad for. And then everything was going along fine, and at 40 I had another severe heart attack. I was out of town in Torrey Pines State Beach, and it was cold. We'd gone hiking, and I had severe chest pain, and what I now know is congestive heart failure, which was terrifying. I was taken to Scripps Hospital down in San Diego, and again they determined I was having a heart attack. I had more blood clots in the same area, and they did angioplasty and put some more stents in. Was there for a week, and I returned home. Continued to have more issues with congestive heart failure, and my primary cardiologist told me that I needed a heart transplant. After having my first heart attack, I was very frustrated because nobody was listening to me. I knew what the symptoms were. I had taken anatomy, physiology. I was in the health industry myself. Time went on. I did feel better, obviously, but then due to life stresses, I had the second heart attack. Because that one was so major, I was in San Diego for a while. They contacted my cardiologist, and together they decided I needed a heart transplant. So I was referred to UCLA, did a bunch of testing there. They check every body organ when you're going to have a transplant. And then I was denied heart transplant at UCLA. I was very frustrated. I was very depressed. I had 2 children. I thought I was going to die. I didn't have much hope for several months. And then the new year came. I had new insurance that was even better. After looking up statistics on the website, I went to Cedars-Sinai. There I met Dr. Ann Hickey, who is an extremely professional and expert in her field as a cardiologist. Because of her, she had me go through more testing, and they reviewed what the results were with what had happened in the past, and she said there's probably no lack of evidence to show that I needed a heart transplant. So through time, I was listed in July. I was ecstatic, still nervous. Then I was on deck in September, meaning that the person ahead of me listed for a heart transplant, they were unable to reach. So I spent the whole day wondering if it was really going to happen, who's going to take care of my kids, etc. I finally called them and said, "What's the deal?" And they said, "We found the person ahead of you, so you're first in line." In October 6th, I got a call at 3 o'clock in the morning and told that they had a heart for me. So everything worked out, had the kids covered, drove up to Cedars, had the transplant on October 6th. Surgery was 4 hours. I woke up a half an hour after surgery, wide awake, felt my new heart pounding out of my chest. So there was no doubt in my mind that I may not have gotten a heart. I certainly had a new heart, and it was healthy. Since then, I've gone through cardiac rehab, and everything is very good. They go through a lot of testing. After a transplant, they have you come in weekly for biopsies to check for rejection, which now they can do with a blood test, which is awesome. I'm just blessed and very grateful to the donor family and my donor, and also to Cedars for saving my life. I'd like to encourage anybody, any woman that feels like they're not being heard, to speak up for yourself, because that's how you're going to save your life. And also, if you would please consider being a donor. There's many people that need organ donations of all kinds. They can only get them if we're willing to give a gift of our organs, a gift of life. Thank you.